Imagine you are giving yourself an insulin injection, a routine part of your day. You have likely performed this action countless times, making it seem automatic. But what if, in a slight rush or distraction, you pull the needle out just a moment too quickly? What really happens in that scenario? It is a common, yet important, concern for many individuals who relying on insulin to manage their diabetes effectively. If you happen to pull your insulin needle out too soon, the most immediate and common consequence is that a portion of your insulin dose might visibly leak out from the injection site. This leakage means your body may not receive the precise, full amount of medication it needs to properly regulate your blood sugar levels as intended by your healthcare provider. This subtle oversight can have real implications for your glucose control and overall well-being. The underlying reason for this potential leakage is quite fundamental to how insulin is designed to work within your body. Once insulin is accurately injected into the subcutaneous tissue, which is the fatty layer just beneath your skin, it requires a brief but crucial period to fully disperse and begin its absorption process into your bloodstream. Your skin and the surrounding tissue naturally present a slight resistance, and the tiny channel created by the needle acts as a temporary pathway. If the needle is withdrawn too hastily before this internal dispersion and the natural closing of that pathway occurs, the pressure from the injected liquid and the body's natural tissue elasticity can cause a small amount of the liquid insulin to backflow out through that very tiny needle track. Essentially, it needs a moment to settle in and for the skin to seal around it. To effectively prevent this unwanted leakage and ensure you receive your complete dose, a simple yet profoundly important step is to count slowly after the insulin has been delivered. After you have pushed the plunger all the way down and verified that the entire dose is in, it is vital to keep the needle gently inserted in your skin for a minimum of 5 to 10 full seconds. Many diabetes educators and healthcare professionals specifically recommend counting slowly to 10, often using a method like 1001, 1002, to ensure sufficient time for the insulin to settle and for the injection site to close effectively. For those using insulin pens, it is equally important to listen for the audible click confirming dose delivery, and then continue to hold the pen firmly in place for that recommended count. Additionally, maintaining the correct injection angle, typically 90 degrees straight into the skin, helps ensure the insulin is deposited in the optimal subcutaneous layer. And remember, avoid rubbing or massaging the injection site immediately after withdrawing the needle, as this action can also inadvertently encourage leakage. An excellent practical tip to make your counting more consistent and effective is indeed the 1001, 1002 method, which naturally slows down your internal clock more reliably than merely counting numerical digits. This technique helps you truly ensure that critical absorption time is met. After withdrawing the needle, always take a quick glance at your injection site. Even a very tiny, visible drip of insulin on your skin could be a telltale sign of an incomplete dose, prompting you to be more diligent next time. Furthermore, consistent rotation of your injection sites is not just about comfort. It helps maintain healthy, viable tissue for consistent insulin absorption, significantly reducing the likelihood of future leakage issues or other skin complications. By integrating this remarkably simple habit of extending the needle dwell time by just a few additional seconds into your injection routine, you gain a significant advantage in managing your diabetes. This small but powerful adjustment ensures you consistently receive your full, prescribed insulin dose, leading directly to more stable and predictable blood sugar management. It also brings immense peace of mind, alleviating worries about underdosing and the potential for inconsistent glucose levels. This little habit truly represents a significant step towards maintaining your healthy and well-managed lifestyle.